My name is Kayzy Bigler, and I am the Unit Director at KDHE in the Bureau of Family Health. And when this COVID project was first introduced, I was one of the staff that helped to bring it about. I have the privilege in my role of working with the Special Healthcare Needs Program, which the model was based off of, as well as the infant, toddler, and all things women, infant, and children. So all of Title V projects. So to give you a little bit of background on me.
So what is the Essential Worker Health Fund? How is it structured? How is it different from the work you were doing before?
Okay, so the Essential Workers Health Fund was really about helping those essential workers during the COVID pandemic that we need to count on, such as first responders, medical staff, home visitors, childcare, those that worked in grocery stores, to really make sure that we were providing some support for them because they were out there and more likely to have contact with people that had COVID. And we wanted to make sure that if they contracted COVID, we could be there to support them and provide some medical support, also some lost wage support, as well as a small stipend to help them cover things like medical over-the-counter medicine, to and from medical appointments. In some cases, they needed childcare for small children because they were sick with COVID, and that was an expense that the family incurred.
So were the folks that you were working with, the individual Kansans that you were working with once the program got started, were these people that were new to you? I mean, were these people that you had been working with in the program or all new, or what was that like?
Absolutely. What we had worked with before was all families that had children with special healthcare needs, birth to 21. So yes, this was a new realm, but we had a holistic care coordination program that we based this all off of to really make sure that we were meeting the needs of the COVID clients and making sure we were following up with them to make sure that things were happening as they needed to really help them get physically and emotionally healthy.
And how'd the program come together? How long did it take from the time you received the first call or email to being functional?
Just a few weeks.
Oh, wow.
Yeah, we, the first time that Rachel reached out to me, it was really to kind of say, is this even possible? Can we do this? And after we talked about it, yes, we said it was possible. We could base it off of the special healthcare needs format. We just need to make quite a few modifications. But she did tell me that there was a pretty short turnaround window. And so we had it up and running within just a very few weeks.
So how many workers, how many Kansans have you been able to support through the program?
590 applications. And out of that 590, 161 were child care and home visitor workers. And then the remaining 529 were essential workers that ranged from janitorial workers to first responders to healthcare workers, just a wide variety of essential workers that were needed to keep the economy going.
Right. And how much money on average are they? I mean, how much money moves to individuals who apply to the program? What's that look like?
Well, total we spent $1.6 million. The fund was originally an $8 million fund that we were able to give back funds to the recovery office, but it was $1.6 million that we spent. 1.4 approximately went towards the essential workers that we kind of lumped as other, and then the 400,000 went towards the child care group. And that covered, like I said, all medical expenses that were not covered by insurance, or if they were uninsured, that covered them, as well as the over-the-counter kind of expenses through a stipend, because we gave each of them a $1,500 stipend. And then also the lost wages. That was a really big area that there was a lot of need there.
What are some of the things you've learned about the workers, the Kansans that you were serving, or about the program, or about the agency and its interaction with folks?
We really learned a lot about the families and COVID and the impact that it's had. It's had a really strong impact on families. Some of the stories were heart-wrenching. We did deal with with several families that the person ended up dying before, before our project ended. But we heard a lot of different stories. But I think that the thing that was the most impactful was that they felt so ostracized. that other people didn't want anything to do with them because of COVID. And it was leading to a lot of mental health issues. We were seeing a lot of that, but we were also seeing reoccurring issues that were from people that started in March, that with COVID, that 6 months later were still having health issues, heart, lung, motor issues, just dizziness and tiredness and constant headaches and pain, chronic pain. So there's been a wide variety of things that have lingered, but depression has been probably the key for a lot of them, or the biggest one that we see. And there was a lot of clients that, you know, we followed up with on a regular basis because we were seeing such strong signs of depression, and making sure to get them in mental health treatment.
Yeah. And that you mentioned that category of other, you know, the sort of big chunk. What are some of the types of workers in that category? What are some of the what's the range of folks that were being served?
It varied so much. We had a lot that were in the healthcare industry, of course. Teachers were a part of that. We had a lot of like maintenance workers, shipment people, you know, for transportation for goods. We had workers that were in grocery stores, or that worked in residential treatment facilities, or just, you know, residential care facilities. A lot of those care facilities, a lot of staff were, you know, we would see waves of that.
As we continue as individuals, communities, businesses, a state to deal with it, what are you anticipating? What are some things that you've learned that you know now to be better prepared for, or you're looking ahead for, or that you may even be concerned about?
Well, I think there's a continuous need, I think, for what we did. I think that we would have had a lot more of the funds used and not given so much back if all of the people, like the insurance companies, really stepped up to help with some of the medical costs that we hadn't anticipated. We're waiving some of the copays and deductibles
Oh,
for
yeah.
short periods of time. So I think, you know, that made a big difference. But I think this is something that would have probably been really beneficial if it was still going on, just because there's so many out there that, you know, are still affected by COVID, and they're affected long term. I think that we're going to see a lot of long term effects from this for some individuals. Some would recover very quickly, and others, it was really just going on for a very long period of time that they just couldn't get up to full recovery.
And I'm guessing catching them off guard, right? I mean,
Yes.
I can't imagine. I would think that would be frightening
Yes.
and frustrating.
Yes. And how they were trying to cope with it, you know, with a loss of income. And I mean, we heard things from, you know, like, I'm going to lose my house because I haven't been able to make a house payment because I haven't gotten paid because I've been off. You know, to, you know, I don't know how I'm going to feed my children, you know. So we heard a wide variety of different stories. And it, you know, it was heartbreaking sometimes.
Yeah.
But it really, I think it's going to be an ongoing, long-term thing, especially again with the mental health. I think COVID has left a mental health
Yeah.
component on a lot of these individuals that have had COVID. Um, and so, you know, it's really going to be a struggle, I think, for a while.
So challenging work for you, for the whole team,
Yeah.
but how do you feel about it? Are you proud of this work? Do you feel like the program has been successful?
I am. You know, we had our moments as program staff where we cried with the clients. We absolutely did. But we also had our moments that we celebrated.
Mm.
I recall one lady that I worked with, and she was a child care provider and just a lovely person. And when I first called her, she was so very sick that she could hardly talk. Her doctor refused to treat her because she had COVID, and he said he didn't do COVID in his office. And she was, you know, she had been to the hospital, into the emergency room a couple of times, and was just very afraid, and had very small children. And as I worked with her, and again, feeling that ostracized, you know, being ostracized was really hard for her. And as we worked together, we actually celebrated as she recovered. Like, I would call and check on her, and together we would celebrate that. And one of these days we're going to meet post COVID and just have a good cup of coffee together.
Yeah, right.
But yeah, so we had, you know, we had definitely some of those moments. But then we also had somewhere, you know, families we would check in, and then the loved one had died. And that's really hard because we go through the grief with them as
Yeah.
well. So yeah. So we experienced a lot of highs and lows, but overall, it was such rewarding work. And I knew it would be from the start. It was a lot of work and it was exhausting, but it was well worth every moment that we put into it.
Thank you for doing it.
You're welcome.
So are there any resources or points of access or aspects of the program that you want to make sure people know about?
So I really think it's important that if people have follow-up things that they need, because we know that there's still needs out there. We know that families are still struggling a little bit with, utilities and rent and food insecurity and that type of thing. So one thing that I would like to say is having them know that they could go to 1-800-CHILDREN. It's a phone line that KDHE supports that really can help get them geared where they need to be. And it's 24/7 answered, and it's answered in English and Spanish, so they can get in contact with whoever needs to really guide them for their county and their area, because each county has individualized resources. On our KDHE website, we also have a whole bunch of COVID resources there. So I would encourage people to go there and check that out. All kinds of different things that they could really access to help them kind of move forward.
And what's that website? KDHE.gov?
KDH, yes.
Okay. Does the program make the designation of essential worker, or do they have to be referred in another way? I mean, how does that happen?
So we had a list that came from the recovery office of what was, and from the Spark committee of what was considered essential workers, and that was the list that we worked off of and determined where they would be. And that was really the only criteria, is that they had to test positive for COVID and they had to be an essential worker. Other than that, it was a quick application process to qualify. And we had it all online. We worked with the KU's public partnership program to make sure that we could have a system so that it would go right into the website for the healthcare fund, the Heroes Relief, and then we could make sure and pull those down and get those processed as quickly as we could. So we did those. We would take paper applications. We took them through the electronic format. We had them through mail. We were getting them all different ways you can imagine.
Mm-hmm. All right. Anything else? Are there any other bits of this or stories or pieces of this that you want to make sure essential workers and everyone knows?
Just if there's any stories that you would like me to share. I mean, there's a lot of different stories. I will, I think one that would be really important to mention, I have several different ones, but one of them was a first responder and a father of, with a family of 7, and he was the sole supporter. And he was very, very sick, hospitalized for several weeks. And at one point, I don't think that they thought he was going to survive, from what he said. And he had been sick for quite some time, no income coming in. Things were really, really tough for the family, and all these medical bills were flooding in. So, he was really grateful for this fund and had a lot of positive things to say, because, we really helped him when he was really down and needed it. And he was so excited about that. We had a lot of tears with families when we would call and say, we can help you. They just couldn't believe that there was something out there. And they were so grateful to the governor's office and the governor for making this possible. We had, as I said, several individuals that were very depressed and felt very ostracized, that we were really able to get linked up with the appropriate services. We had even some families that had, health literacy issues. That was, that was a challenge. That's hard to navigate all those systems of care. And we were able to step in and help them do that, to make it easier, to make sure that they were getting all of their needs met, because that was really important.
Yeah, that's interesting. So they may be confused or uncertain about what's happening with their body and their personal health, and then knowing where to go and what to do is hard if you don't already know those systems.
Well, and even knowing that, their insurance company would be sending them something called an explanation of benefits to let them know what they were responsible for paying. A lot of families just didn't know. And of course, that's a very late thing coming in. So we were able to help them get those in a timely manner, so we could then pay what they owed, versus them getting a bill 6 months down the road and not knowing how they were going to pay it.
Yeah, right. Any other stories?
Then the other elderly gentleman that I spoke with the first time that I called him, and I explained why I was calling. he just broke down and started crying. And we had to get past that before I could even find out why he was crying. And his first words to me were, "You're the first person that has asked me how I'm doing. Nobody's cared." And he said, "Even my neighbors won't even talk to me because they're so afraid I'm going to get COVID, even though I'm better." And he was still having residual effects, a lot of tiredness, a lot of weakness. But he said, nobody wants anything to do with me now that I've had COVID. He said, I'm just so ostracized and I feel so alone. And again, we worked on mental health services for him, but he really appreciated this fund and has stated that emphatically over and over again, but really appreciated more than anything, I think, just the contact, to have somebody contact him and check on him on a regular basis to make sure he was doing okay.
Mm-hmm.
So that's
How did you feel in this program? How did this program, what kind of light did this program throw upon what these folks need even without COVID? I mean, that must have been kind of interesting too.
Well, with the special healthcare needs program, we deal with a lot of that.
Yeah, right.
So we're kind of used to that, but it was in a different light. It was a different way because a lot of these were, you had medical professionals who you think are probably okay, and you're finding out that they are struggling just to have food because they've lost income for so long.
Mm-hmm.
And it's just so, all the medical expenses were piling up. So it's really been interesting to see people that, you think are middle class. Um, all of a sudden they're not,
Yeah.
because COVID has affected them so harshly. I do too want to mention that all of the promotional materials and all of that were done by KDADS, but this was a collaboration of all state agencies coming together to identify that this fund was needed and really working collaboratively to make this happen. I do want to commend the Spark committee and all the people that participated in that executive committee and the governor and the governor's office for, allowing this opportunity for these families, because they very much appreciated it and it was so needed. And I think of where some of these families would have been without this fund, and it's a real harsh reality. And especially when, we were moving into December and Christmas, and we were able to lighten that load for them. It really felt good. It was really
Yeah.
heartwarming. So, yeah.
Yeah. This has definitely been an extraordinary steep learning curve for every single one of us, and
Yes.
I'm glad we've had folks like you helping us do it together.
Well, thank you for the opportunity.